Okay, we're continuing on with lecture 25. In 25A, we talked about oral routes of administration and all the different factors we have to think about when we're using the digestive system to get a drug or substance into our body. For this section, we're going to talk about things that we absorb across mucous membranes. This is a different way of organizing it than the book does, but I think it makes more sense conceptually. Absorption across mucous membranes means that you're absorbing the drug across a goopy, wet part of your body. So the inside of your mouth, right? Goopy, wet, glistening. The inside of your rectum, goopy, wet, glistening. Vagina, inside your nose. So these are all what are called mucous membranes. They all have mucus on the surface of them. And so what's interesting is that you can place a substance there and it will kind of dissolve into the mucus. And then as we see in this diagram here, right? So here's our little bits of the drug that have dissolved off of this pill. It can either, depending on the chemical properties of the drug itself, it can either move through the cells, like we see here, like if it's a lipid soluble thing, then it can move through the plasma membrane and then down and into our bloodstream, or it might actually be able to squeeze in between the cells and get down and into our bloodstream. So this is a really interesting way to be able to get a medication into your bloodstream, right? You don't have to do the whole intestine and hepatic portal vein and first pass situation. So let's take a look at each one of these different routes of administration in turn. Sublingual and buccal. I put these together because they're both in the mouth. So sublingual literally means underneath the tongue. Nitroglycerin, for example, is a medicine used to treat angina or chest pain due to blockages in the coronary arteries. And you can't take it orally because it will actually get busted apart by your digestive system, so you can't swallow it. You put it underneath the tongue and it slowly dissolves and diffuses, as you can kind of see in the diagram again below. The green, this is like a THC or a CBD oil or something that they were showing in that, right? But it just kind of moves across and gets into the bloodstream that way. So sublingual means under the tongue. Buccal means you park it in the side of your cheek. This is a pretty fast way to get a drug into your system. And there's no first pass metabolism. So even though you might think of the mouth as being part of the digestive system, and it is, but it's not part of how we normally absorb nutrients and other things from our food. So the veins, the capillaries and veins from the mouth do not go down to the liver first. So they go into the general circulation. So whether this be medications or certainly chewing tobacco, right? That's buccal. You park it in your cheek. Don't recommend that, however, because it's highly carcinogenic with chronic exposure over time. So that's an individual who had an oral cancer as a result of using chewing tobacco. Interestingly, one of the things that we can use to treat nicotine addiction, right? So nicotine is the active drug in tobacco that is the addictive substance. We'll talk about addiction in lecture 26, is nicotine gum. And what's interesting about the nicotine gum is you don't just chew it and swallow your saliva, because you actually don't want it to go through your whole hepatic portal system. Instead, what you do is you chew it a little bit and then you park it in your cheek. And then you chew it a little bit to kind of release some more of the nicotine and you park it in your cheek. So it's actually kind of a buccal form of administration, which is interesting. We can also use the other end of the tube. So we can also put things inside the rectum. So it's exactly the same. It's another mucous membrane. It's just from the other end of the tube. So medicines that are given this way are usually called suppositories. They're often made in these little capsule-like things, and they're often made with wax that gets nice and slippery, so it's easy to kind of slip it inside, and then that kind of melts and the active ingredient is released. Why would we do this? Well, it can be really good for kids who can't swallow pills, especially if, like, you say, well, we could get a liquid. Well, we could, but sometimes they taste really, really nasty, or maybe we need it to act really quickly. Swallowing things and waiting for it to be absorbed through your intestines into your bloodstream and then make it through the liver and then into the general circulation, that's a relatively slow process. Maybe we need the medicine to get into your bloodstream faster. So rectal administration can be a good way to do that. It's also a really good way to treat things like severe vomiting. If somebody's having severe vomiting, it's going to be really hard to get them to keep something in their mouth or to swallow something. So you can use a rectal suppository with an anti-nausea medication. It's also really useful for people who are having active seizures to use suppositories to get the medicine into their body that doesn't require you to use a needle, right? Which if somebody is like physically thrashing around, you don't necessarily want to be like trying to get the needle exactly where you need it to be. So rectal administration can actually be very useful in a large variety of settings. Now, the interesting thing about the rectum is that it's technically part of the digestive system. So the upper part of the rectum, those veins do then drain into the hepatic portal system and go through first pass metabolism. The lower part of the rectum, however, doesn't. So we get some first pass metabolism with rectal administration, but it's about 50% of what you see compared to if you were to swallow the same dose of medication. We can also administer things vaginally. There's two different scenarios in which we want to do this. One is if we're treating a vaginal problem. So if somebody has a vaginal yeast infection or bacterial vaginosis or something else in the vagina, it makes sense you can use these little plungers, and they don't actually look like that, but this was what the diagram that Wikipedia had. You can use these little applicators, these little like plunger things to push a gel or a cream medication inside the vagina, which is what we're seeing there. And then it's sitting exactly where you need it to be, kind of like the vancomycin inside the intestines, right? So you can deliver the medicine right where you need it to be acting, and it doesn't need to be absorbed, right? If it's just treating something that's going on inside the vagina itself. But you can also use the vagina for mucous membrane absorption into the bloodstream. And that is how the NuvaRing or the birth control ring works. This is what it looks like. It's a little plastic polymer ring, and it's been kind of impregnated with, right? So it's kind of built in with the estrogen and the progestin hormones that are used for birth control. You insert it into the vagina, it just stays there, and those medications slowly leach out of the ring and are absorbed across the mucous membrane directly into the bloodstream. So pretty cool, no first pass metabolism there. Pretty slow, steady state, works really well. We also use vaginal rings for hormone replacement therapy with estrogen in postmenopausal women. So there's kind of a long history there of using that route of administration. You might be like, Dr. Hall, could we use a rectal suppository vaginally for like seizures or something? Yeah, you probably could. The epithelium is thicker, however, so the absorption is going to be slower. So probably not recommended. Then you can get things in your nose, right? So we also have mucous membranes inside our nose. And if you take a look at this diagram, you can see there are tons of blood vessels in that mucous membrane inside your nose. And you know this if you've ever had a bloody nose. It is not that difficult to get a bloody nose. We don't have other parts of our bodies that generally just start randomly bleeding, or with a very minor trigger that they randomly start bleeding. So there's a really thin membrane there underneath which there are these massive blood vessels, right? So this is actually like looking with a little camera in at the inside of somebody's nose, and you can see, right? It'd be really easy for a drug to get very quickly, if its chemical properties allowed, absorbed across the mucous membrane and into the bloodstream. So this is how people snort cocaine. Yes, this is why. So they take the cocaine and they use the edge of the credit card or whatever to like mash it into as fine a powder as possible, and then they snort it into their nose, and then it sticks to the mucous membrane and then dissolves in the mucus and gets absorbed across and goes right into the bloodstream. Very rapid absorption because it's such a thin membrane, so many blood vessels, and again, there's no first pass metabolism here. It's going right into the general circulation. Okay, so for our summary slide for mucous membrane absorption, I just put them in a table here. So buccal is when you park it in your cheek, it's going to be rapidly absorbed. Sublingual, same thing, it's just under your tongue. Rectal, again, rapidly absorbed. The only difference here is you're going to get a little bit of first pass metabolism, which you would just account for in your dosing. Vaginal we can use, it's not as rapid. As I mentioned, the epithelium, the membrane is thicker there. It's pretty durable and resilient as it needs to be. So it takes a little bit longer for things to get absorbed. So it's not super fast. But again, no first pass metabolism there. And then nasal, with all of those blood vessels, you get very rapid absorption. And again, no first pass metabolism. So that's it for mucous membrane absorption. Next, we're going to do parenteral administration, if I can talk. See you there.